Hi, this is Mary Pat Whaley, and welcome to a short webinar today on ICD-10 CM, Getting Started Today. And the reason why we call it Getting Started Today is because you can get started today after you spend 20 minutes with us hearing about how to get started on your ICD-10 action plan. Today I'm going to use ICD-9 and ICD-10 instead of, I-9 and I-10 instead of ICD-9 and 10, just to shorten things up a little bit. It is a short webinar, and I want to make sure everybody knows that we're discussing the CM version of I-9 and 10 because that's what relates to physician services, Part B services with Medicare in particular. If you're looking for information on ICD-10 PCS, that is not us, that is the Part A hospital facility side of things. So we're going to talk about an action plan and how to crosswalk your ICD-9s to 10s, and in particular the tool that we use. The crosswalk that we're talking about, that everybody's talking about, is finding the right ICD-10s so that you can start to utilize those in your practice as soon as possible and start to get used to it and get in your mind, oh, if I'm thinking this in 9, it's this in 10. We're not going to talk about documentation or denials today. Documentation, of course, is important because the medical chart has to support the code chosen, and obviously we're not going to see any denials until after October 1st. But recently, CMS, the Centers for Medicare and Medicaid Services, has announced that they are going to give us a 1-year break on getting the absolutely right ICD-10. They haven't given us complete clarification on what being in the right code family means. I have some ideas, but there's a lot of discussion online about that, and I'm sure when that's clarified there'll be something on our Manage My Practice blog about that. So hopefully you've had a chance to talk to your software vendors or your billing company, practice management or billing or EMR system. ICD-10 codes are utilized in each and all of those for different things based on what you're using the software for. And of course you want to know, is your software, is your billing system or your EMR ready for I-10? And if so, what does it mean? Does that mean they've just thrown the I-10 codes in there and it's up to you to find them? Or is there actually a crosswalk that helps you map from 9 to 10? And does that crosswalk go both ways? 9 to 10 is very difficult if somebody says that they have that. Because for one code in ICD-9, there may be many, many codes in ICD-10. The other way is much easier because many codes can map to one code in ICD-9. If there is crosswalk software already installed in there, make sure you get trained on, and if there isn't, you need to ask when it's going to be available. This is probably one of the biggest problems we hear about from practices is the software people say, oh, we'll be ready for October 1, but you really need that software to do some playing around before then. So the first thing we want to do getting started is collect your top ICD-9 codes from the past 12 months. You ideally will run a report from your practice management system or ask your billing system, your billing company or service to run a report for you of all ICD-9s that you've used in your practice in the past 12 months and have the list arranged by the number of times used, so most used at the top, least used at the bottom, because you're going to use this for a cutoff point as to how many codes you're going to do in your initial crosswalk. If your providers, if you're in a multi-specialty group or even within a single specialty, providers do different kinds of services, you may want to run a list for each provider. Another option would be to run your providers or your practice favorite diagnosis codes or pick lists that are kept in the system. Sometimes, again, this is in the EMR side. Every once in a while we'll see it on the billing side, but it's predominantly on the EMR side. Run a report or take a screenshot of the lists or contact your vendor or billing company and find out how to get them. If you're using a paper super bill, this is a great way to collect your nines, is to look at your current super bill and work with your physicians to kind of talk through which codes you want to use. I think a typical back of a encounter form will hold 200 plus codes, and you might want to just talk to your docs about, or your providers about, which ones they're currently using the most. If you have no way to run a report from the practice management system and you don't use a super bill, contact your national specialty society like the American Academy of Pediatrics, the AAPE, or American College of OBGYN, the ACOG, and see if they supply a list. Check their website, but also don't hesitate to call them. Sometimes they have resources they don't put on the website. A last option, these are 5 options I've given you, a last option to collect your top ICD-9s is the roadto10.org, which is the CMS website for ICD-10, and they have provided top diagnoses for family medicine, peds, OB-GYN, cardiology, orthopedics, and internal medicine. The primary cares, of course, because they cover a broader span of codes, and cardiology and orthopedics because they are the specialties that are most affected by this change in terms of the greatest explosion of additional codes. They do not have other specialties, however, they have some other top codes that are used across many specialties such as pain, asthma, diabetes, headache, hypertension, otitis media, syncope, and UTI. So that website is http://www.roadto10.org/example-practice-other, or you can just go to roadto10.org and click around looking for it. So I want to suggest that everybody who needs to crosswalk their ICD-9s to 10 seriously consider using an encoder. Encoders have been used on the hospital side of healthcare for years and years, but there have not been the same kind of very technical software support as much on the physician side. For the ones that have been on the physician side, they've also been exorbitantly priced. So I'm happy that we now have at least one choice that is reasonably priced. So an encoder is basically the books that you use to code CPT, HCPCS, ICD-9 and 10 in electronic form. And integrated with that is coding and sometimes billing rules in an associative way. In this connects to this how, or this is related to this how. So the cross-indexing is the very important part in an encoder. The encoder that we use that we really like, something that we use every day, is called Swift Audit Search. Actually, Swift Audit Pro is the Swift Audit Search Plus that has a lot more ability, but what I want to talk to you today about is the search, because they have a 30-day free trial to crosswalk your code. So you can start your trial, get your ICD-9s together, and start crosswalking them. And I'm going to show you a little bit how to do that. So end of 30 days, you've got your crosswalk. You don't see any advantage in continuing. Yay, you're done. But you may find other ways that it could be of advantage to you, and you want to actually pick up the subscription. So the search box is at the top of the screen, every screen in Swift Audit Search. And so I just put in a very simple, straightforward code, the one everybody knows, 250.00, diabetes mellitus. And you can see that right away, this is a screenshot. When I put that in, it brought up ICD-9 and it gave me the full description. What you cannot see, because this is not a live version, is the little down arrow beside the search magnifying glass will give you the option to search for I9, I10, or both. And I always keep mine set at both. This one, obviously, 250.00 is an ICD-9 only. There's nothing else available in the box. If I clicked on that 250.00, I'm going to get an expansion box that maps me across to ICD-10. The two codes it gives me is an E11.9 and an E13.9 with two codes for diabetes. So always clicking on the diagnosis code is going to take you to the next level of information. Finding the correct ICD-10 is kind of like peeling back an onion. You're going to go to a further layer to a more specific code, very similar to the way ICD-9 is, but just takes it a little bit further. Another choice is to type text in the search box instead of an ICD-9 code or an ICD-10 code. You can type text in the box, and I think this is extremely helpful. Under the text box, when it brings you up, you have a couple of informational things. One are these building blocks to help build your search. If you want to clarify diabetes along with other words, you can click on any of these blocks to build your search, and that will automatically pop up and research. In addition, you can look at the index results, which is actually straight from the book, and you can see that there are, and of course these are clickable codes like everything, and you can see there's two different sections that diabetes is going to show up, once in the E section and one in the R section. So when I clicked on the E section, I got a big explosion of more codes. This is the, I can type the text in the search box with the ICD-10 chosen, or I can type in the text and use my building blocks to go down further. So you're going to get all the possibilities, and you can see here's some 3-digit and here's some 4-digit, all under the E family. Here's a situation where both ICD-10 and ICD-9, excuse me, let me go back one. I think I slightly misspoke. This is one where I only chose to see ICD-10 in the search box with diabetes, and this is where I chose to see 10 and 9 in the search box with diabetes. I explained that incorrectly. So here you can see, and I kind of like this. Of course, the green is the 9 and the 10 is the blue. I like seeing both of these together. That gives me like a frame of reference, a place to get started. So I may want to click on a 9 and understand a little bit more about that, or I may want to go to my 10s and look at those. In the, I did choose 024.4, which is gestational diabetes mellitus. And this is one of my very favorite things about this encoder, is it's going to give me a lot of information really very clearly presented. So 024 was kind of my family code, and then it came down to 0.4 for gestational diabetes mellitus. But right away I have a specificity note that says, hey, there are more specific codes available. Down here is where the next codes are. So anytime you get to this page and there's going to be more specific codes, they're going to tell you you can go further, and they're going to provide you what the next ones are. In addition, this particular one has, you're going to end up using codes for weeks of gestation, which those of you in primary care probably understand and know all about. And then we have another little note here about this is for the maternal record and does not have to do with the newborn. Oh, let me go back just a minute. I wanted to show you these helpers. These are 5 helpers that appear when there is information, more information to know about these codes. And of course, these are very comparable to any kind of notes that you see on any coding book that says, don't use this here or this goes here. So I'm going to show you what they are. So here are the notes that break down into information about these codes. Here's this maternal records note again, and you can see it's underlined when it's open. You're not going to see all these on the same page. I cut and pasted them so that you could see them. Use additional code, and it's telling you you're going to have to put a Z code in for the weeks of gestation to identify the specific week of the pregnancy. In OBGYN, we have trimesters and we have weeks of gestation. In excludes one or do not code with, we have something that should not go along with this code. And then excludes, remember we have an excludes one and an excludes two, not included here. In other words, you're going to have another code if one of these apply. And then inclusion terms, these are things that would be included here. This is a whole lot of information. I love these coding helpers. All right, so let's give you a couple more examples, very common examples across a lot of the different specialties. So I have fatigue, 780.92, and I'm going to use Swift Audit Search and type in fatigue. I find personally I get more to start with when I type something in. So I typed fatigue and index results. I got a couple of index results here at the bottom. I clicked on the index and got all of these beautiful codes that show up in different chapters of the ICD-10. And if you've been studying your ICD-10, this is not supposed to be educational about how to code, but you know that the different chapters of ICD-10, the letters in each of the chapters are very specific about what they mean and what they relate to. And M, which is one of my favorite ones, because M stands for musculoskeletal. I mean, I don't think it really does. That's how I remember it. And you can see we've got fatigue fractures over here. So this is going to help you continue to peel back the onion and go further and further. I happen to choose chronic fatigue unspecified, which was R53.82. Again, you can kind of see the breadcrumbs where I came from, what the family 3-digit was, and then went to 4-digit, and then went to 5. Here are my notes, all my helpers here, giving me information about making sure I'm getting not only to the exact right code, but to any additional codes that need to be added. All right, here's another one, pain 789.09. I chose to put abdomen in first. One thing that's a little different with 10 versus 9 is that you are typically going to use the site first and then the condition, which is a little bit backwards from the way ICD-9 is. So I chose to put abdomen, so I'm looking for abdominal pain. And you can see I got a bunch of building blocks for narrowing in on it, and I got a list of ICD-10s that I can start to whittle down what I'm looking for. I clicked on the building block that says pain, and right away I got 2 ICD-10s, one pain localized to the upper abdomen, and one pain localized to other parts of the lower abdomen. Now, I know that those probably are not specific enough, but let's go to the next page and see. Aha! So not only do I need to be more specific, they also are bringing laterality in here. So I need to go one more digit, and you can see the next codes are upper abdominal pain unspecified, right upper quadrant, left upper quadrant, and epigastric. So I chose right upper quadrant pain, clicked on my code like always, and I just broke out the notes so you can get an idea about what kind of notes are in there. Now, R is a very important chapter because R is signs and symptoms, and on the physician side of the house, we often don't know what is causing a problem. So you can see that right upper quadrant pain It doesn't have any words like due to or manifestation of or because of or and. It's just right upper quadrant pain. So if a patient comes in to see you and you're going to have some tests done, basically all you have so far is right upper quadrant pain. Remember that R are those signs and symptoms. Okay, so I talked a little bit about your practice crosswalk and what you're going to do with all this wonderful information that you get from Swift Audit Search. This is just a very basic one that I put together, and I used the cluster headache. So I started with my I-9 code, which I just said that, you know, it could be a lot of practices are just using 339.00, but there's also a 1 for episodic and a 2 for chronic, which you may not know at the time for whatever reason. And then I started to pull out, using Swift Audit Search, the particulars in I-10 that had to do with cluster headache. And the description under a cluster headache is and other trigeminal autonomic cephalgias, or TAC, T-A-C. And you can see how it's been split out into episodic, intractable, unspecified, not intractable, episodic, intractable, episodic, not intractable, chronic intractable, and chronic not intractable. Now, don't think that's everything that has to do with cluster headaches. There is a lot more, but just to take a look at where you would be starting. Now, if you are a neurology practice with a headache center or a headache specialist, or headache is a lot of your practice, you're probably going to spend a lot of time in the G's, and maybe some time in the R's in signs and symptoms. If you're primary care, you may still get a lot of headaches. If you're pediatrics, you might not get many headaches at all. So the way you follow and peel back the onion is going to have a lot to do with going back to your most used ICD-9s, but also breaking out the codes that you're most likely to use based on your patient population and your specialty. So once you have your cheat sheet done, what are you going to do with it? Well, your crosswalk spreadsheet, well, you're probably going to create some cheat sheets, and those could be for physicians in their dictation stations or workstations. It could be for pocket cards. This really depends on how your physicians absorb new information. You know what kind of cheat sheets or helpers they want. I've seen some practices create multiple super bills based on the patient's complaint. So they may have one whole super bill that has to do with fractures and orthopedic types of problems, maybe if they're in urgent care. Create a new favorites or pick list in your system if you can go ahead and preload it without wiping your I-9 out. I also really suggest, in addition to your 30-day free Swift Audit trial, that you get one for each of your physicians so they can get the hang of starting with a code that they know, 250.00, and letting them drill down. The cool thing about this is that it's on their phone, and you know how many physicians use their phone for information, whether it's Hippocrates or PDR or whatever they are using their phone for. So this is something that you can see on your phone. It's mobile enabled, as well as they could also have a tab open on their computer or their tablet, and they could go back and forth and get acquainted with it. So the 30-day free trial isn't just for you, it is excellent for your physicians to get them used to digging down to get the right code. Now, if you'd like some more information, please contact us. We'd be glad to talk to you about it. The email is my partner Abe, ABE, at managemypractice.com, and there's his phone number. We also have a landing page on our site that has to do with the Swift Audit Pro and how to, you may have actually gotten this webinar through the landing page, but it has a form if you want some more information, have a question, want to request us do more webinars specific on specialties and how to find codes. And you can also, while you're on the site, sign up to get an email when we publish new content, because of course we're starting to really publish a lot about ICD-10. I want to thank you so much for joining me for the webinar today on how to get started with ICD-10 CM. Get those crosswalks going, get your 30-day free trial with your encoder, get your crosswalks going, and get yourself ready for October 1st, 2015. Thank you.